The hip is a ball and socket joint where the thigh bone joins with the pelvis. Surrounded by cartilage, muscles, tendons, and ligaments, it is the deepest and largest weight-bearing joint in the body. The pelvis has a cup-shaped socket called the acetabulum, lined with cartilage. Another layer of cartilage enables the head of the femur to smoothly articulate with the acetabulum. A healthy hip can be damaged by disease such as arthritis or injury. When the cartilage wears away, bone-on-bone rubbing occurs, resulting in lack of motion and pain that can affect day-to-day activities. When non-surgical treatments are no longer effective, an orthopedic surgeon may recommend total hip replacement. Total hip replacement may be performed through different surgical approaches, and your surgeon will select the best one for you. Once the surgeon accesses the hip joint, the diseased head of the femur is removed. The hip socket, acetabulum, is prepared by using special instruments to make it the right size and shape for a new implant. A metallic shell with a cup-shaped liner is pressed into the prepared socket. The femoral head is replaced with an artificial ball on a stem that goes down into the hollow part of the thigh bone and may be pressed into place or cemented, depending on the surgeon's preference. The ball and socket are then placed together to complete the procedure. The goal of hip replacement surgery is to alleviate pain and improve a person's quality of life. The specifics of recovery and rehabilitation will be determined by the surgeon based on a patient's condition.